Welcome to Shri Medical College. Today we will explore dialysis technology and access, choosing the best option for your needs. End-stage renal disease, ESRD, is a condition in which the kidneys are unable to perform their normal functions of filtering waste and excess fluid from the blood. Dialysis is a life-saving treatment that restores kidney function after they have been damaged. When conventional treatments for renal failure have failed, dialysis procedures such as hemodialysis and peritoneal dialysis are performed. In order to make educated judgments about your dialysis treatment, you should have a fundamental familiarity with the various modalities available. Artificial kidneys, also known as dialyzers, are used in hemodialysis to filter waste and excess fluid from the blood. Hemodialysis requires the use of two needles, one to withdraw blood through the access and deliver it to the dialysis machine, and another to return the filtered blood to the patient. When the kidneys are no longer functioning properly, peritoneal dialysis can be used to filter the blood and eliminate waste materials. Peritoneal method of blood filtration is distinct from hemodialysis. Peritoneal dialysis involves the introduction of a cleansing solution into the abdomen via a catheter. It is the function of the peritoneum, the lining of your abdomen, to filter the blood and eliminate toxins and other unwanted substances. After a predetermined amount of time, the filtered waste fluid drains out of your abdomen. These remedies can be used anywhere, whether at home, in the office, or on the road. Unfortunately, not all people with renal failure can undergo peritoneal dialysis. To maintain independence at home requires manual dexterity and the ability to care for oneself, or a trustworthy carer. Hemodialysis consists of draining a patient's blood supply, passing it through a machine to remove waste products, and then reinfusing the purified blood. Hemodialysis is most commonly performed at a medical facility like a hospital or dialysis center, however it can also be done at home. For the duration of the treatment, dwell time, dialysate is infused into the abdominal cavity and left there. Small blood veins line the interior of your abdomen, and the dextrose in the dialysate helps remove toxins, pollutants, and excess fluid from your blood. After the dwell period has passed, the solution and the blood metabolites it has extracted drain into a clean collection bag. Hemodialysis is a procedure that is used to remove waste products and excess fluid from the body in place of the kidneys. In order to accomplish this, an artificial kidney, also known as a dialyzer, is used. Through a system of plastic tubing, your blood is pumped to a dialyzer for purification before being re-infused into your body. Each treatment session begins with the insertion of two needles into your access. The plastic tubing attached to these needles is what transports your blood to the dialyzer. There is only a small amount of blood leaking out of your body at any given time. The dialysis machine is responsible for the blood pumping, treatment time, temperature, fluid drainage, and pressure. Hemodialysis is a therapy option, and it can be done at a dialysis center, where a nurse or technician will assist you throughout the process. Most patients undergo hemodialysis 3 times weekly at a clinic, with each session lasting 3 to 4 hours on average. In-clinic procedures typically occur at set intervals. Exchange refers to the practice of having fluid pumped into and subsequently drained from your abdominal cavity. A variety of dialysis techniques utilize the peritoneal cavity for wide range of exchange frequencies. dietary restriction are less severe with CAPD and CCPD, two types of continuous peritoneal dialysis. Continuous peritoneal dialysis prevents the buildup of potassium, sodium, and fluid, in contrast to intermittent hemodialysis. This gives you greater dietary freedom than you would have while on hemodialysis. Extended renal function after kidney failure. Patients on peritoneal dialysis may keep some of their kidney function for a little longer than those on hemodialysis. In a peritoneal equilibration test, PET, blood and dialysis solution samples are compared in real time during an exchange. How rapidly or slowly waste poisons are removed from the blood into the dialysate is shown by the test results. You can use that data to see if your dialysis might benefit from a shorter or longer stay of the solution in your abdominal cavity. If you want to know how much of a given waste product, urea, is being eliminated from your blood during dialysis, you can have a blood sample and a sample of spent dialysis solution examined. A urine sample might be taken to check the urea concentration if you are still urinating. Dialysis cannot begin unless an access is created or placed. Hemodialysis patients will have an AV fistula surgically implanted in either their arm or leg. A synthetic tube that is biocompatible with the patient's body is used for the AV graft. Before beginning peritoneal dialysis treatment, a patient will have a minimally invasive surgical operation to insert a catheter into the abdomen to serve as the dialysis access. One method of vascular access is the central venous access catheter, CVAC, a long, Y-shaped tube made of flexible plastic. To get to your veins, your vascular surgeon will make a tiny cut in your neck, chest, or groin. The catheter is subsequently placed subcutaneously into a major vein. If you require urgent or emergency dialysis, you must use this access method. If an artery and vein can be successfully connected during surgery, the resulting arteriovenous fistulae, AV fistulae, provides an extremely useful surgical access. This setup allows your PCT to access high-pressure, high-flow blood for more efficient hemodialysis therapy. In terms of efficiency, an AV fistula is the best dialysis access option. This treatment for kidney failure has a low risk to patients and is long-lasting. However, the link needs to be mature enough to be used in dialysis, which can take several months. Patients with end-stage renal disease, ESRD, whose veins are weak or thin and who need dialysis immediately can benefit from arteriovenous graft, ARV graft. Your doctor will insert a catheter into an artery and vein to gain access to the blood supply. There is no immediate connection between the vein and artery, and the healing process can be lengthy, weeks. Your doctor will take your specific circumstances into account before recommending either an AV fistula or an AV graft. The PD catheter used in peritoneal dialysis is different from the hemodialysis catheter used in conventional hemodialysis. It filters blood using the intestinal lining and the dialysate solution. To use this access for dialysis, a PD catheter is required. Dialysis outcomes and general health can be enhanced by consuming a diet low in salt and phosphorus. The assistance of a dietitian is recommended when creating a personalized diet. Your doctor will recommend a diet based on your renal function, diabetes, and high blood pressure. It's also crucial to take your meds exactly as advised if you want the finest outcomes. Peritoneal dialysis patients may need various medicines to manage blood pressure, enhance red blood cell count, regulate blood nutrition, and prevent phosphorus buildup. Join Shri Ram Medical College's Bachelor of Vocation in Dialysis Technology and take the first step toward a successful career in dialysis technologist. We are here to assist you in launching your career as a dialysis technologist. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Ram Medical College, nurturing next generation of healthcare leaders, and offers all paramedical courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Ram Medical College. Good luck, goodbye.